What if I told you that you can check your health in under 10 seconds, without any test, without any machine, just by looking in the mirror and sticking out your tongue? Before your body breaks down, it gives signs. Not in complicated reports, not in expensive tests. Right here, on your tongue. That small muscle in your mouth can reveal early signs of poor digestion, stress, heat, inflammation, nutrient deficiency, poor circulation, dehydration, and even long-term weakness. In traditional Chinese medicine, the tongue is not just for tasting food. It is a map, a mirror, a daily health report you have been carrying around for years. So, tomorrow morning, before you brush your teeth, before coffee, before food, stand in front of a mirror, stick out your tongue, and look carefully. The color, coating, shape, cracks, moisture, movement, and even the teeth marks along the edges may be sending you a message, one that most people miss entirely. Now let me show you exactly what to look for and what to do about it. Before we dive in, if you are new here, welcome to Nature Bliss Care. This channel is dedicated to helping you understand your body through the lens of integrative and natural health, blending traditional Chinese medicine with modern science. Every new video we upload is designed to give you practical, evidence-informed tools to care for your body naturally. Hit subscribe and tap the notification bell so you never miss a new video. First, what does a normal tongue look like? A healthy tongue is light pink or light red, slightly moist, not dry, not overly wet, covered with a thin white coating, though you should still be able to see the tongue body through it, textured with small bumps called papillae. Not swollen, unusually smooth, deeply cracked, or discolored. If your tongue looks like this on most mornings, your internal system is relatively well balanced. Now, let's decode what an abnormal tongue is trying to tell you. In TCM, Giovanni Mascioscia, one of the most respected modern teachers of Chinese medicine, explains that tongue diagnosis centers on two key things: the tongue body and the tongue coating. The body reveals the state of qi, blood, yin, yang, and the internal organs. The coating gives clues about digestion, fluids, and pathogenic patterns like dampness, heat, cold, or phlegm. In this first part, we are going to cover 5 signs. Each one is distinct, each one is actionable. And by the end, you will already know more about reading your tongue than most people ever will. 1. Pale tongue. A pale tongue looks lighter than normal, sometimes almost washed out. When you see this, your body may be signaling that it's running low on nourishment or vital energy. In TCM, a pale tongue often points to qi deficiency, blood deficiency, yang deficiency, or internal cold. Alongside the pale tongue, you may find yourself dealing with low energy and persistent fatigue, dizziness or lightheadedness, shortness of breath, cold hands and feet, poor appetite and sluggish digestion, light or scanty periods in women, feeling tired even after a full night's sleep. From an integrative health standpoint, a pale tongue can raise clinical questions about anemia, low iron, low vitamin B12 or folate, poor nutrition, chronic blood loss, or underactive thyroid function. How to nourish and rebuild. Start with warm, cooked meals. Your digestive system works significantly better with warm food than cold. Aim not to skip meals, as consistent nourishment is what builds blood over time in TCM. Incorporate iron-rich foods like fluted pumpkin leaves, spinach, beans, eggs, liver, fish, and lean meat into your daily routine. Always pair iron-rich foods with something vitamin C-rich, an orange, tomato, or bell pepper, to meaningfully improve absorption. One important note: avoid tea or coffee directly after iron-rich meals, as the tannins in both can reduce iron uptake by up to 60%. Hydrate with intention, not habit. Start your morning with 1 to 2 cups of warm water. Sip consistently every 1 to 2 hours rather than drinking large amounts at once. Aim for 2 to 2.5 liters daily, more if you sweat heavily. Repair your sleep. Put your phone down at least 1 hour before bed. Aim to sleep by 10 to 11 p.m. and keep your room dark and cool. Consistent sleep is one of the most underrated tools for rebuilding blood in TCM. Acupressure, stomach 36, Zusanli. Located 4 finger widths below the kneecap, slightly outside the shin bone. This point helps your body produce energy and build blood over time, and it also improves how well you absorb nutrients from food. Press firmly for 1 to 2 minutes each leg. Do this once or twice daily for at least 4 weeks. If your fatigue is long-standing, continue up to 6 to 8 weeks. Consistency matters more than pressure. Laboratory tests to consider: complete blood count, serum ferritin, vitamin B12, serum folate, thyroid function test. 2. Red tongue. Moving along to one of the most commonly spotted changes, a tongue that is distinctly deeper red than normal. In TCM, red means your body is running hot. Depending on the full clinical picture, this could reflect full heat, empty heat, liver heat, heart fire, stomach heat, or EAN deficiency. From a modern medical angle, a red tongue may accompany fever, systemic inflammation, vitamin B deficiencies, infections, allergic reactions, or oral conditions. Other accompanying symptoms include thirst and a persistent dry sensation, constipation, irritability or a shortened fuse, disturbed sleep, night sweats or hot flashes, acne, a burning sensation in the body, dark or concentrated urine. Here's something worth noting about location. If the tip is particularly red, TCM connects this to heart heat, emotional stress, anxiety, and sleep disturbance. If the sides carry the redness, it tends to point toward liver heat or stress-related imbalance. We will cover both of those specific zones in Part 2. How to cool and rebalance the system. Reduce alcohol, smoking, excess pepper, fried foods, and late-night eating. All of these generate internal heat. Replace them with cooling foods like cucumber, watermelon, pear, leafy vegetables, and light broths. Stay well hydrated. Calm the nervous system. Take 10 minutes daily of screen-free, quiet time. Practice slow breathing. Inhale for 4 counts. Exhale for 6 counts. This directly activates the parasympathetic nervous system and helps reduce heat driven by chronic stress. Process anger and frustration rather than suppressing them. In TCM, suppressed anger is one of the most direct generators of liver heat. Sleep reset. Cut caffeine after 2 p.m. Keep a consistent lights-off time daily. Acupressure, large intestine 4, Higu, located in the fleshy webbing between your thumb and index finger. This point moves stagnant qi, reduces tension, improves circulation to the head and face, and helps ease facial heat and inflammation. Press firmly until slightly sore. Hold for 1 minute on each hand. Use daily for 2 to 4 weeks. Caution: avoid during pregnancy. Laboratory tests to consider: C-reactive protein, fasting blood sugar, liver function test, complete blood count, vitamin B complex panel. 3. Purple or bluish tongue. This is one of the signs that TCM practitioners take most seriously, and with good reason. In TCM, a purple tongue signals blood stasis. Circulation that has slowed, become sluggish, or stopped flowing as freely as it should. From a biomedical perspective, purple or bluish discoloration can relate to reduced oxygenation, cardiovascular dysfunction, respiratory conditions, clotting disorders, or the effect of certain medications. This particular sign should not be taken lightly, especially when it appears alongside chest pain, shortness of breath, dizziness, fainting, blue lips, or severe weakness. If you notice that combination of symptoms, please seek medical attention promptly. Other symptoms that may accompany a purple tongue include fixed or sharp pain that doesn't shift, dark, clotted menstrual blood, cold extremities, varicose veins or visible vascular changes, localized recurring headaches, supporting circulation and flow. Cut back on trans fats and excess sugar, both of which impair vascular health over time. Work toward a healthy body weight. Address chronic stress. It directly compromises circulation when sustained over months and years. Move every single day. Walk for at least 30 minutes daily. Stretch every morning. Avoid sitting for longer than 1 hour without standing up and moving. Drink warm or room temperature water. Avoid iced cold drinks. In TCM, these are seen as constricting to blood flow, and in modern physiology, extreme cold may affect peripheral circulation in sensitive individuals. Acupressure, liver 3 plus large intestine 4, the 4 gates. In TCM, pressing these 2 points together is known as the 4 gates combination, a powerful pairing for moving qi and supporting circulation throughout the body. Liver 3 is located on the top of the foot in the hollow between the big toe and second toe. Slide your finger up the groove until you feel a tender spot. Press and hold for 1 minute on each foot. Use daily for 6 to 8 weeks, especially if symptoms are chronic. Also press spleen 10 shiuehai above the inner knee to move and nourish blood. Checks to consider: ECG, cardiac rhythm and function, blood pressure monitoring, complete lipid profile, coagulation studies, PT/INR/PTT, complete blood count, D-dimer if thrombosis is a concern. 4. Thick white coating. A thick white coating looks like a heavy, difficult to see through layer sitting on top of the tongue. In TCM, this is a classic sign of dampness, specifically cold damp, phlegm accumulation, or weakened digestive function. Think of dampness as the body's version of stagnant, swampy energy. Things aren't being properly processed and transformed. This pattern is remarkably common today, and you can trace it almost directly to modern eating habits. Excess refined sugar, bread, dairy, cold drinks, fried foods, and heavy meals late at night. Modern medicine also recognizes that a white tongue coating can stem from accumulated bacteria, food debris, dead cells, dry mouth, poor oral hygiene, smoking, or fungal overgrowth such as oral thrush. If the coating is very thick, persistent, or doesn't improve with lifestyle changes, a clinical evaluation is worthwhile. Signs that often accompany a thick white coating: bloating and a feeling of fullness even after small meals, a heavy, sluggish sensation in the body, brain fog or difficulty concentrating, loose or soft stools, excess mucus and catarrh, unexplained weight gain, low appetite combined with strong sweet cravings. Clearing dampness from the inside out. Fix digestion first. Stop drinking cold beverages during and after meals. This single shift alone can make a noticeable difference within weeks. Move toward warm, cooked meals, soups, stews, congis. Reduce sugar, excess dairy, and refined flour. Eat slowly and without distraction. Stop eating after 8 p.m. Drink warm ginger tea once daily. Ginger gently activates digestive energy and helps the body process and move dampness. Acupressure. Spleen 9, yin linguin. Located on the inside of the leg, just below the knee joint in a soft hollow. This point drains excess fluid, relieves bloating and heaviness, and improves the body's water metabolism. Press deeply for 1 minute on each leg. Use daily for 3 to 6 weeks while actively adjusting your diet. Also press stomach 36 to support digestive energy. Laboratory tests to consider: fasting blood sugar and HbA1c. H. Pylori test. Stool analysis. Complete lipid profile. Thyroid function test. 5. Yellow coating. If the previous pattern described a cold, sluggish state, a yellow coating tells a completely different story. This is heat. A yellow tongue coating, especially when thick, greasy, or sticky, typically signals damp heat in TCM. Depending on where the coating concentrates, it may reflect stomach heat, liver gallbladder heat, or infection-like patterns. From a biomedical angle, a yellowish tongue can be associated with poor oral hygiene, dry mouth, smoking, high-dose B2 supplements, bacterial overgrowth, or systemic issues. Common accompanying symptoms include persistent bad breath, a bitter taste in the mouth, particularly first thing in the morning, acid reflux or heartburn, constipation, dark or strong-smelling urine, yellow sputum or discharge, skin breakouts, irritability, a burning sensation during urination, vaginal discharge with an unusual odor, persistent yellow discoloration that doesn't respond to lifestyle changes should be properly investigated. How to clear heat and restore balance. Drink 2 to 2.5 liters of water daily. Add vegetables to every meal. Significantly reduce fried, spicy, and processed foods. Cut back on sugar and sugary beverages. Avoid alcohol. Prioritize oral hygiene. Brush twice daily, gently scrape your tongue, and floss. Do not suppress possible infections with random antibiotics. Test properly, treat appropriately. Acupressure. Large intestine 11 tsuchi plus stomach 44 kneading. Large intestine 11. Bend your elbow and find the outer end of the elbow crease. That's the point. This is a powerhouse for clearing internal heat and supporting the body's natural detox pathways. Press firmly for 1 to 2 minutes daily for 2 to 4 weeks. Stomach 44, between the second and third toes. Specifically used in TCM for stomach heat, bad breath, and heat-related digestive disturbance. Laboratory tests to consider. Urine analysis. C. Reactive protein. Liver function test. H. Pylori test. Fasting blood sugar and HbA1c. We have covered 5 signs and 6 more to go. You have just learned to rid 5 of the most common tongue patterns your body uses to communicate. The pale tongue that asks to be nourished. The red tongue signaling heat. The purple tongue warning of stagnation. The thick white coating pointing to dampness. And the yellow coating telling you that heat has built up inside. Each one carries a message. And now you know how to hear it. But we are only halfway through. In Part 2, we cover the remaining 6 signs and much more. The link to Part 2 is in the description. Don't stop now. The second half is where things get particularly personal. Thank you for watching Part 1 all the way through. If this is already helping you see your body differently, please hit the like button. It genuinely helps Nature Bliss Care reach people who need this kind of content. And if a friend or family member complains of fatigue, digestive issues, or stress, share this video with them. Sometimes the most powerful thing we can do for someone is point them to the right information. Drop a comment below right now. Which tongue sign do you recognize in yourself most often? I read every single comment, and your answer may help someone else feel less alone. Your body is always communicating. We are here to help you listen. See you in the next one.